Today we're going to talk about ways to prevent falls in residents with dementia. To begin with, falls are fairly common in the middle or latter stages of the disease. About 25% of residents are going to fall within the first week of admission into a new facility, and about 75% will fall within the first year. So falls do occur in individuals with Alzheimer's disease. What we want to do is reduce the risk that the person will fall, or if they have that kind of an accident, to reduce the likelihood that they're going to be seriously injured. Finally, we want you to know what to do in the event that a patient falls and cannot get up. Today's segment will help you understand ways to maintain a safe environment within your facility.
Falls are common in older residents with dementia. Falls are also more dangerous for older people than they are for younger people. Older people may have softer bones and smaller muscles. As a result, older people are more likely to break one of their bones when they fall. Falls can cause serious injuries like a broken hip, broken wrist, or a head injury. It is very important for everyone to work together to prevent falls.
Did you know? Falls are common in older people, especially those with dementia. A past history of falls is a major risk factor for future falls. You should never move a fallen resident who cannot get up or who complains of severe pain. The best treatment for falls is prevention.
The first step in fall prevention is recognizing residents who are at great risk of falling. A past history of falls is a major risk factor for future falls. Any resident who has fallen in the past must be very carefully watched during any activity to prevent another dangerous fall. The 5 main causes of falls are weakness, sensory problems, intellectual problems, health problems, and environmental hazards. A resident can become weak after suffering a stroke or from lack of exercise. Physical activity is very important for residents. Weaker residents can slowly rebuild their strength through regular exercise. Residents should not be restricted to a wheelchair unless absolutely necessary. They need as much exercise as they can get to maintain their strength and prevent falls and injuries. On the other hand, residents who have suffered a stroke may not be able to regain their strength and may need your continued assistance. Give special attention to stroke residents, especially during rising, sitting, or moving to the toilet to prevent falls. Sensory problems that can cause a resident to fall include poor eyesight, poor hearing, and poor sensation in the legs and feet. Poor eyesight can cause residents to misplace their feet or stumble over stairs, rugs, or other objects on the floor. Poor hearing can cause residents to become disoriented and may also increase their risk for falls. Make sure residents wear their glasses and hearing aids at all times. Some residents, especially those with diabetes, have poor sensation in their feet and legs. They are at greater risk for falling because they might misplace their feet while walking, especially at night. Pay careful attention to these residents during any activity to prevent a dangerous fall. Intellectual problems are the result of brain damage caused by dementia and can put residents at greater risk for falls. Forgetful residents may not remember to use their assistive devices, like walkers, canes, Mary walkers, or wheelchairs. Demented residents may also forget how to use their assistive devices. Remind residents who need help walking and show them their walker or cane. Brain damage caused by dementia may also make it difficult for residents to get dressed. They may get tangled up in their clothing or put their shoes on incorrectly, putting them at greater risk for falls. Demented residents may have difficulty with communication, which can also increase their risk for falls. A resident who needs your help moving to a wheelchair or getting out of bed may forget how to ask for help. Pay special attention to residents who have trouble communicating. Some residents with dementia may even forget how to walk. These residents also need your assistance and attention. If a resident's behavior indicates a new risk for falling, you should contact your nurse or supervisor immediately. Health problems that may cause residents to fall include low blood pressure, fainting, and side effects from medications. When residents with low blood pressure rise to stand up, their brains may not be getting enough blood, and they may become dizzy. Encourage these residents to rise slowly and then stay with them until the dizziness passes. Residents with heart problems may faint and fall. Pay special attention to these residents to prevent dangerous falls. Residents who receive large numbers of medications may suffer from side effects, which could put them at greater risk for falls. If you suspect that a resident's medication is causing dangerous side effects, notify your nurse or supervisor immediately. Environmental hazards which put residents at greater risk for falls include room lighting, cluttered floors, bathrooms, open stairwells, uneven exterior surfaces, and other aggressive residents. Try to keep your facility well lit to avoid confusing shadows and to make it easier for residents to see clearly. Keep walking areas clear of potential fall hazards like clothing, unprotected power cords, or slippery throw rugs. Be especially careful in the bathroom. The bathroom's smooth, slick floor is a dangerous space and puts residents at greater risk for falls. Residents need your attention and assistance in the bathroom to prevent falls. Control residents' access to stairs and make sure residents only use the stairs when you can watch them and help them out. Walking outside your facility may put residents at greater risk for falling. Grass and pavement outdoors are often uneven, and the bright sunlight may distract residents. Always take residents outside with enough staff to watch each resident carefully. Aggressive residents may push, shove, or trip other residents and cause dangerous falls. Remember, prevention is the best treatment for aggression as well as falls.
Watch them all the time, making sure they're not at a fall hazard. So we try to watch, and we have some that are prone to falling. So have to kind of be with them at times when they're making steps and try to make sure that they don't fall.
Even though prevention is the best treatment for falls, residents do sometimes fall. If a resident starts to fall, don't try to prevent the fall. Guide the resident easily and safely to the floor, bending your knees, not your back. Stay calm and stay close to the resident. Try to keep the resident calm and call for help. You should never move a fallen resident who cannot get up or who complains of pain. Call for medical assistance. The fallen resident may need to go to the emergency room. If you are sure a resident is not injured, you can carefully help the resident get up. With assistance from a coworker, slowly and gently help the resident sit up and then move to a standing position. If a resident falls at night or on the weekends, don't forget to report the fall to your regular daytime supervisor. Falls should also be reported to a resident's family as soon as possible. Remember, any resident who has fallen before is at a greater risk for falls and must be watched very carefully in the future. Clara is clueless. Mr. Carroll has Alzheimer's disease and poor vision. He needs his glasses to see. He fell and broke his hip last year, and sometimes he forgets to use his walker.
Where's my walker?
Can't you see it? It's right next to you.
Oh. Well, I need to go to the bathroom.
Well, go ahead. I'm sure you'll do all right.
What did Clara do wrong? She ignored Mr. Carroll. She didn't remind him to wear his glasses. She didn't move the blanket out of his way. She didn't help Mr. Carroll with his walker. She sent Mr. Carroll to the bathroom alone. Sandy is smart. Mr. Carroll has Alzheimer's disease and poor vision. He needs his glasses to see. He fell and broke his hip last year, and sometimes he forgets to use his walker.
Thanks. I've got to go to the bathroom.
Okay. Well, you don't want to go anywhere without your glasses. Here, put these on.
Okay. There.
All right. And here's your walker. Now, whenever you're ready, put push yourself up slowly.
Okay.
Now keep that walker in front of you, and let's move very slowly.
I'm just going to the bathroom. I can do that by myself.
Remember when you fell last year and got hurt? I don't want that to happen again. I'll just help you get over there and sit down and give you some time to yourself, and whenever you're ready to get up, I'll help you again.
Oh, all right.
What did Sandy do right? She paid attention to Mr. Carroll. She picked up his blanket. She helped him with his walker. She helped him put on his glasses. She remembered that Mr. Carroll fell last year and now has a greater risk for falling. She helped Mr. Carroll in the bathroom because bathrooms are particularly dangerous places for falls. Clara is clueless. Mr. Ross has Alzheimer's disease, and he can be quite unsteady. He has fallen several times in the past, and he's just fallen again.
Mr. Ross, how could you fall again? Oh, this is so terrible. What are you doing on the floor? Come on, Mr. Ross, get up. How am I supposed to know what's wrong with you if you don't get up?
No, help!
What did Clara do wrong? She panicked. She did not stay calm. She scared Mr. Ross. She didn't check to see if he was hurt. She moved Mr. Ross without knowing if he was all right and without any help. Sandy is smart.
Oh.
It's all right, Mr. Ross. Everything is going to be okay. Don't move now. I'm going to take care of you. Stay right where you are. I'm going to call Sarah to come help. Sarah, will you come help me, please? Don't worry, Mr. Ross. Everything is going to be fine.
Hi, Mr. Ross. Can you tell me where it hurts?
My hip hurts.
It's okay. That's all right, Mr. Ross. I'm going to call an ambulance.
It's going to be okay. Here, let me get this pillow to put under your head. Okay. And here's a blanket to keep you warm. I'm going to stay right here with you. I'm going to get you to a hospital, and they'll take good care of you there.
What did Sandy and Sarah do right? They stayed calm. They tried to keep Mr. Ross calm. Sandy called for help. Sarah found out where Mr. Ross was hurt. Sarah called an ambulance. Sandy tried to make Mr. Ross more comfortable. Sandy stayed with Mr. Ross.
Mr. Nicholas has mild dementia. He also has problems with his vision. He has fallen several times in the past. What can you do to help Mr. Nicholas?
Tell him to remember not to walk without help.
Watch Mr. Nicholas closely. Keep the floor clear of hazards.
Tell him to use a cane.
He needs to leave your facility.
Mr. Gomez has dementia and likes to wander. You find him on the floor in the bathroom. He has fallen, and he tells you that his leg hurts. He also seems to have trouble straightening his leg. What can you do to help Mr. Gomez?
Force his leg straight.
Ask his family what they think.
Pull Mr. Gomez to a standing position.
Reassure Mr. Gomez and call your supervisor for help.
Mrs. Fott has many medical problems. In addition to dementia, she has severely high blood pressure and heart disease. She tells you that sometimes she feels dizzy when she stands up. How can you help Mrs. Fott?
Tell her to remember to be careful.
Tell her doctor that her blood pressure medicine is wrong.
Tell your supervisor, assist her until the dizziness passes.
Take her to the emergency room.
Ms. O'Neill has mid-stage Alzheimer's disease, and she fell several times at home before she came to your facility. What is the best way to manage Ms. O'Neill?
Wait until she falls and watch her carefully.
Monitor her very carefully.
Give her a cane or a walker.
Miss O'Neill needs to leave your facility.
Mr. Jones is very unsteady on his feet, and he has fallen several times in the past. You realize that he is at risk for falling, and you talked to his family about the problem. What is the best way to manage Mr. Jones?
Monitor and assist him.
Keep Mr. Jones in a wheelchair at all times.
Restrain him in a chair.
Tell his family he needs to leave your facility.